Welcome back to another episode of HealthCap Weekly Wrap. We've got a shorter episode for you today. We just got back from the ACA NCAL Annual Expo in Las Vegas. And wow, what an incredible event. It was so energizing to see the innovation, passion, and dedication across the senior living industry all in one place.
Yeah, it really was. There's just something about being in the same space with professionals from all over the country, sharing ideas, seeing new technologies, and hearing firsthand what's working in different communities. It's a great reminder that we're part of a much bigger movement to make aging better, safer, and more meaningful.
Exactly. So if we had the chance to connect with you while we were there, we're so glad we did. And if we happen to miss you, we're sorry we didn't cross paths, but hopefully we'll get another chance soon.
Now, even though today's episode is going to be a little bit shorter than usual, we've still got some really interesting stories lined up, and each one has direct implications for the work you do every day. We're starting with a feel-good medical breakthrough that involves dogs, and not just therapy dogs. We're talking about trained diagnostic dogs.
Right. This one feels like science fiction in the best way. Researchers in the UK recently published 2 studies showing that trained dogs can detect Parkinson's disease by smelling sebum. That's the natural oil our skin produces.
Yeah, and what's remarkable is that in one of the studies, the dogs achieved a sensitivity of up to 80% and a specificity of up to 98%. That means they were not only good at detecting Parkinson's when it was there, they were also very accurate at identifying when it wasn't.
And this wasn't just a random observation. The training process took almost a year, and the dogs, named Bumper and Peanut, by the way,
Adorable.
right, were part of a double-blind study. They were trained using skin swabs taken from the upper backs of people with and without Parkinson's, and then tested on completely new samples.
And I love this part of the story. It was inspired by a woman named Joy Milne. She's a retired nurse who has a heightened sense of smell. And she noticed that her husband developed a different body odor years before his Parkinson's diagnosis. That observation led her to work with researchers and eventually to these groundbreaking studies.
It's really incredible. In the second study, researchers used mass spectrometry to chemically analyze the sebum samples, and they found over 50 distinct molecular markers that were different in people with Parkinson's compared to healthy controls, and even in people with REM sleep behavior disorder, which is often an early sign of Parkinson's.
That could mean we're getting closer to a future where a simple, non-invasive skin swab could be used to help detect Parkinson's, even before symptoms start. And for us in senior living, that's huge. Early detection could mean earlier treatment, more proactive care planning, and potentially better long-term outcomes for residents.
Exactly. Parkinson's is such a challenging disease, especially once mobility or cognition starts to decline. The idea that we could intervene earlier, even just by having better screening tools, could really shift how we support residents and their families.
All right, let's move on to something more clinical but equally important. The Infectious Diseases Society of America recently updated its guidelines for treating complicated urinary tract infections, or CUTIS. These actually came out earlier this year, but they're still very relevant, especially in senior living.
Absolutely. UTIs are one of the most frequent reasons residents are sent out to the hospital. And complicated UTIs, which can involve things like catheters, diabetes, structural abnormalities, or resistant bacteria, make treatment a lot trickier. So having clear guidance on how to handle those cases is a big help.
So the new guidelines lay out a 4-step process for choosing empiric antibiotic therapy. Step 1. Assess how sick the resident is. Are they septic? Are they stable? That determines how aggressive your initial treatment needs to be.
Step 2 is evaluating risk factors for drug-resistant bacteria. That could be a recent hospitalization, previous antibiotic use, or even just the presence of a catheter. Step 3 is considering individual patient factors, things like allergies, kidney function, and comorbidities.
And then step 4 is checking your local antibiogram. Basically, your community's antibiotic resistance patterns. That helps you choose something that's more likely to work while avoiding unnecessary broad-spectrum antibiotics.
And the guidelines also emphasize shortening treatment duration. So instead of the standard 10 to 14 days that a lot of us grew up with, they're recommending 5 to 7 days in many cases, especially if the resident is responding well to treatment.
And they also clarify when it's okay to switch from IV to oral therapy, which is a big deal in senior living. Being able to finish treatment in the community instead of transferring to a hospital or skilled nursing can make a big difference for quality of life.
And again, this ties into stewardship. The less we rely on prolonged or unnecessary antibiotic use, the better outcomes we'll see long term, both in terms of resistance and overall resident health.
All right, next up, we're talking about emergency preparedness. Argentum recently published an article highlighting the push for more standardized crisis planning across senior living communities.
And this is something we've all had to think about, especially in the past few years. Between COVID, wildfires, hurricanes, and everything in between, the need for clear, actionable emergency plans has never been more obvious.
Right now, a group called the Quality Assisted Living Coalition is working on draft emergency preparedness guidelines. The goal is to bring more consistency and clarity to how assisted living communities prepare for and respond to emergencies.
And what's great is they're actively seeking feedback from providers. They want to make sure these guidelines reflect the realities of running a community, not just idealized checklists.
It's a real opportunity to shape the expectations and best practices that could eventually become part of regulatory frameworks. And for operators, having this kind of guidance means less guessing and more confidence when the unexpected happens.
It also improves communication across agencies. When everyone's working from the same playbook, coordination gets a lot smoother. Whether it's evacuating residents, maintaining continuity of care, or keeping families informed, it all gets easier when the plan is clear.
It's definitely something worth paying attention to, especially if your community is reviewing or updating your emergency operations plan right now. And don't forget that HealthCap has a great toolkit on emergency preparedness in our resource center. We'll link it in our show notes.
And speaking of being prepared, we want to wrap up with a quick shout out to the Crisis Prevention Institute.
Yeah, if you're not familiar with them, they're a training organization that specializes in de-escalation and behavior management. Their programs are used widely in healthcare and education, and they're especially valuable in memory care settings.
So many of us have dealt with moments when a resident is agitated or confused, and knowing how to respond calmly and effectively makes all the difference. CPI training gives staff the tools to handle those moments with compassion and confidence.
It's not about controlling behavior, it's about understanding it, anticipating what might escalate it, and responding in a way that keeps everyone safe and supported.
If your team hasn't had CPI training, or if it's been a while, it's definitely worth looking into. It's one of those things that can reduce stress, lower risk, and build a more positive culture overall.
All right, that's going to do it for this week's shorter episode.
Thanks so much for tuning in. We really appreciate you spending part of your day with us.
And as always, if you want more details on any of these stories, be sure to check out the weekly roundup on Angie's blog at healthcapusa.com/Angie's-blog.
We'll be back soon with more insights, stories, and updates from across the senior living industry. Until then, take care, and we'll talk to you next time.